Welcome to the Dementia Friendly Business Training module for the healthcare sector. This training is provided by Age Guide Northeastern Illinois. The objectives for this training module are to 1. Review dementia, 2. Discuss healthcare strategies for being dementia friendly, 3. Identify some communication strategies, and 4. List some elements of dementia friendly environments. To start, we are going to go over some background knowledge of dementia. You have already seen this in the previous training module, so this will be a quick review. Remember that dementia is the general umbrella term for disorders that cause chronic impairment of the brain's mental process. It often affects an individual's memory, thinking, decision-making, and ability to perform everyday activities. There are many different types of dementia. The 4 most common types, in order from most common to least, are Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. In addition, there is a type of dementia called mixed dementia, which occurs when an individual has more than one type of dementia. Again, you will have seen this as well, so this is just another quick review. Symptoms and signs of dementia can differ depending on a specific type of dementia. However, some common signs and symptoms include communication difficulties, wandering, losing things, frustration, repetition, poor judgment, unacceptable behavior, and confusion. Despite these symptoms, people with dementia are a valuable contribution to their community, and they are still a person. The disease does not diminish that. Next, we will review some healthcare strategies that revolve around the basic, essential ideas of prepare, learn, and respond. Healthcare providers are very likely to interact with those living with dementia. Therefore, it is always important to be prepared for when that is going to happen. Healthcare providers are very likely to interact with those living with dementia. Therefore, it is also important to be prepared when that is going to happen. In order to be prepared, it is crucial to consistently focus on a coordinated, person-centered approach to care. In addition, you may also know the signs of dementia, so that you are able to recognize when a patient has dementia. To the right is a top 10 signs for dementia, which include regularly repeated questions, little notes around the house because people with dementia have a habit of forgetting things, difficulty with everyday tasks, trouble following along with stories or conversations, trouble finding items, getting lost often, hard time communicating, difficulty focusing on one thing at a time, mood changes, and worse behavior at night. Being a dementia friend is a never-ending effort. With that said, an ongoing and continuous education is very important to healthcare strategy. With that said, ongoing and continuous education is very important healthcare strategy. For instance, learning the benefits of an early diagnosis, knowing short-term tools in order to recognize cognitive impairment, having awareness of local dementia resources, and consistently practicing dementia-friendly communication skills and best practices are all critical to creating an inclusive environment for people with dementia. Next, we will go over some strategies for how to respond when you have a dementia patient. The first is to explain the diagnosis and the disease process. This step is really only applicable to patients who are unaware of their dementia. It is important for them to be informed about what dementia means and what to expect. As a provider, you should also assess their cognitive health and abilities to better tailor their care. Along the same lines, you should be referring to dementia specialists and local resources. Lastly, work on developing a care plan that is both holistic and patient-centered. The care plan for a dementia patient must also focus on a high quality of life, and here are just some examples of how to do that. The first one listed is to emphasize what the person with dementia can still do, as opposed to telling them everything they can't do anymore. This approach will make the person with dementia feel more valuable, because the care plan will maximize the abilities and functions that they still have. The care plan should also encourage connection and engagement. Now, this applies to both the person with dementia and their caregiver, because it's important for them both to maintain their social connections. Speaking of caregivers, the care plan will also heavily impact their lives as well. Therefore, it is important to include the caregiver within the care plan by referring them to local caregiver resources. Providers should also be well aware of the signs that indicate caregiver burnout so that proper intervention can be utilized. Finally, a care plan should also include protections against abuse and neglect towards the person living with dementia. As a provider, you must be aware of the potential for abuse and neglect, as well as risk factors and signs. Since people with dementia are especially vulnerable, providers also act as advocates for their rights. For example, reporting instances of abuse and neglect when it's necessary. Like the training mentioned previously, people living with dementia often have a hard time communicating. So here are some communication strategies that could be easily implemented. 1. Avoid talking past them because they are still people. Introduce yourself, use their name, face them directly, and make eye contact with them. 2. Be patient. Use simple sentences and make an effort to speak clearly as well as loud enough for them to hear so they could easily understand. When they don't understand, do not be hesitant to provide them with additional needed explanations. And always ensure that you give them enough time to process and respond. Exercise patience and never try to pressure them to hurry up. 3. Be respectful. When interacting with them, ask for permission. Can I enter your room? Is it okay if I incline your hospital bed for you? Treat them with dignity. Do not argue with them. And make an effort to let them know you are trying to listen and understand. Here are some additional best practices that are specifically in regards to the environment. Dementia-friendly environments focus on being accessible, such as using simple, easy-to-ride navigation signs that help people with dementia so they know where to go. In addition, placing the signs at eye level where they are easily seen increases that accessibility. The lighting of the environment is also something to consider. Providing enough lighting so people with dementia can adequately see, and avoiding heavy glares and shadows that may disorient them. Flooring is also another important aspect. Ensure that there are no obstacles on the floor that might be falling or tripping hazards, such as cables running through walkways, and avoid reflective, slippery, and uneven flooring. As you complete this training module, I encourage you all to view the additional resources in the PDF download on the Age Guide Learning Center or in the description below if you are watching on YouTube. These resources will aid you and your business in your efforts towards the dementia-friendly initiative. Please feel free to download, print, keep, and share the handouts. Thank you for your commitment and conscious effort in caring for people living with dementia in the communities that you serve. Upon completion, a follow-up letter, certificate, and dementia-friendly window cling can be provided to your business. Please share this training far and wide to the other colleagues and other organizations in your network.